If you have peripheral neuropathy and you feel like your treatment has plateaued or like it's not working, like nothing is really moving you forward anymore, there may be something happening underneath the surface that nobody has explained to you. And today I want to walk you through exactly what that is. This video is for anyone living with peripheral neuropathy, especially if you feel like you've tried many things, maybe even tried acupuncture or laser therapy or any other treatments, but your progress has slowed or stalled. My name is Dr. Rebecca Gibbons. I'm a licensed acupuncture physician and registered nurse here in Pensacola, Florida, with over 20 years of patient care experience. Today, I want to talk to you about something that I think is one of the most overlooked pieces of the neuropathy puzzle: inflammation. So what does inflammation actually do? Let's start with the basics. Inflammation is your body's natural response to injury or to a threat. In the short term, it is actually very helpful. It's your body trying to heal. But when inflammation becomes chronic, meaning it sticks around long after it should be resolved, it stops being helpful and it starts being harmful and causing other processes. Chronic inflammation creates an ongoing low-level stress on your tissues throughout your body, including your nerves. Specifically, chronic inflammation can damage the protective coating around your nerves called the myelin sheath. It can also restrict blood flow to nerve tissue, which means your nerves are not getting the oxygen or nutrients they need to repair themselves. So over time, this creates a cycle. Inflammation. It damages nerves. Damaged nerves create more inflammatory signaling, and the cycle continues. This is part of why neuropathy symptoms can feel like they are getting worse over time, even when nothing new is happening to the cause of it. The inflammation itself becomes a driving force. So, here is something I think is important to understand. Conventional treatment for neuropathy is often focused on managing the nerve pain signal itself. So medications like gabapentin work on the nervous system's pain processing. They do not address the inflammation as the underlying driver. As an RN for over 15 years, I saw this pattern constantly in the hospitals where patients would be prescribed medication for pain, but nobody was asking the deeper question: why is this nerve damage continuing or getting worse? Inflammation is very often the answer and is very often left unaddressed. This is not a criticism of any individual provider. It is simply a gap in how conventional medicine is structured. Symptom management rather than the root cause investigation. This is exactly why where acupuncture comes in, and is actually one of the most well-researched effects of acupuncture in the medical literature. So acupuncture has been shown to reduce specific inflammation markers in the body, things like cytokines, which are signaling molecules involved in the inflammatory response. By reducing these markers, acupuncture helps interrupt that cycle I mentioned earlier. Less inflammation means less ongoing damage to nerve tissue and a better environment for repair to actually happen. Acupuncture also improves circulation to the areas being treated, which means more oxygen and nutrients reaching nerve tissue that has been struggling to get what it needs. So when we treat a patient with neuropathy, we are not just thinking about the nerve pain signal. We are thinking about the whole inflammatory picture, which is driving it. How long has it been going on, and what else in the person's health history might be contributing to it? So what does this actually look like in practice? When a patient comes in with neuropathy, part of my evaluation includes looking at potential sources of chronic inflammation, things like diet, blood sugar regulation, autoimmune activity, or other chronic conditions that could be in the home that might be contributing. From there, the treatment plan is not just about the points used for nerve symptoms specifically, it is also addressing the inflammatory picture as a whole. This might include nutritional guidance alongside acupuncture and microcurrent, because certain foods can either contribute to or help reduce inflammation. This is exactly why I do not believe in a one-size-fits-all protocols. The inflammatory picture for someone with diabetic neuropathy looks so much different from someone with chemotherapy-induced neuropathy, which looks different again from someone with an autoimmune component. Your plan has to reflect your specific situation. Reducing chronic inflammation is not an overnight process. I always like to put that out there. It took time to develop, and it takes consistent treatment to reverse. What I typically see is that patients who stay consistent with treatment over several weeks begin to notice their symptoms are not progressing the way they were before, and for many symptoms begin to actually improve. This is one of the most encouraging things I get to witness in my practice. Watching that inflammatory cycle interrupt in a patient's nerve health and them get their life back, it's very rewarding. So if you have peripheral neuropathy and you feel like your progress is stalled or not improving, I would really encourage you not to assume that it is just how it has to be. There may be more happening beneath that surface, and there may be more that can be done. So if you are in the Pensacola or Gulf Coast area, give us a call at 850-530-1028 or find the link in the description below. And if this video helped you understand something new, please share it with someone who needs to hear it.